I mean, my version of that story when he asked me out, the way I remember it is I remember this medical student showing up one day and then just sort of like following me around the hospital. Like I'd sort of be places and then like there he was. And then like I'd go someplace else and he was there too. And I was like, I don't understand what's happening here.
Hi everyone, welcome to episode 2 of The Breakdown with Rothman Orthopaedics. I'm your host, Alex Hammond, and we have a very fun, special Valentine's Day themed episode. Today I'll be chatting with physical medicine and rehabilitation specialist here at Rothman, Dr. Madi Dholakia and Dr. Anupam Sinha. They just happen to be married and under the same specialty. So we'll chat with them about what it's like being married and working together and play a little Newlywed Game, the Breakdown edition. And lastly, for the medical incredible case, I'll be speaking with Dr. Barrett Woods. He's a spine surgeon here at Rothman Orthopaedics. And he had a case that involved a 67-year-old man who fell off his deck and was left paralyzed. But thanks to Dr. Woods and his team, he was able to walk again. Looking forward to hearing more about that. Fun fact, Dr. Woods is actually also married to another Rothman physician, Dr. Shaylin Woods, and she's also a physical medicine and rehabilitation specialist. So we'll get his insight on that as well. First up, I'd like to welcome in two of our very own physical medicine and rehabilitation specialists, Dr. Madi Dholakia and Dr. Anupam Sinha. You guys have been together for 16 years, 14 of those married, and you have 2 young daughters as well. Dr. Dholakia, you have been a Rothman physician for 15 years and Dr. Sinha for 12 years. Am I all correct so far?
Correct so far.
Yes.
Correct so far. All right, good. And I just want to thank you guys again for both joining me. We're going to have some fun, so looking forward just to kind of chatting with you guys. But is it safe to say that you guys have found the key to not only being happily married, but the key to successfully working alongside your partner too?
Yeah, I would say so.
I think we found success in our work and outside of work relationship.
We managed to not annoy each other, which I think is in and of itself a feat.
Yeah, I mean, how do you do that though? So speak a little bit about, obviously when you're home, you guys are married, but are you guys, when you're at work, do you guys work together? Do you research together? What's that like? Talk about that.
So we're in the same office once a week, sometimes twice a week, and we work down the hall from each other, and it's nice. I think, what's funny is when I first started at Rothman years ago, and Nuke joined the practice, one of our senior doctors in our group said, I don't know how that is, working with your spouse. That just seems like a bad idea. Make sure you sort of aren't in the same place on the same day. And it actually worked out for us. Like, I look forward to the days when we're in the office together because we discuss cases, and it's nice to have somebody to run down the hall and say, hey, have you ever seen this before? And, bounce ideas off of him. And I think it makes us better physicians, because it's like 2 brains for the price of one, and
right.
Spend a lot of time at home talking about what happened at work. We're like the world's most boring couple. We just talk about work all the time.
24/7 work.
Yeah, our
Exactly.
kids are kind of annoyed at us. But our dinner time conversation is, I saw the most interesting thing today. And then, we talk about it and one of us will, look it up if we're not sure what the answer is. And I think it just makes us better at our job.
Plus she's smarter than I am, so I can easily bounce off my cases.
That's a smart thing to say. That's
that is
listen,
true.
Yeah, let's go with that, right?
Plus she buys me lunch on our days together, so it's a plus.
Yeah, we trade off buying each other lunch, which is good.
So who bought lunch today?
I did.
Yeah, he bought lunch today.
Okay, good. All right. I want to back up just a little bit. So how did you guys actually meet?
Do you want to tell that story?
Yeah, so I was a third-year medical student, and I started rotating at a hospital in Philadelphia, and she was in her first intern year, in her second or third month. So, I started working, and I saw that there was this cute intern working there as well, and I'm older than her by 2 years, but she's ahead of me in education by 2 years, so like I said, she's smarter. So, I just asked her out one day, and she begrudgingly accepted, and we went out on one date, and that was it for a while. I
was busy.
She was busy.
I was very busy.
It was an intern year, so they're pretty busy, but I was there for about 3 months, and I would ask her out a couple of times again, and she declined for a few times.
Yeah. When was the next date then? So how long?
So we reconnected 2 years later when I graduated med school. And then I think I still had her contact, and I think I asked her to come to, just like we had a small gathering for our graduation, and she ended up coming, and then we reconnected and started hanging out again after I was a full-fledged doctor.
I had time for him.
Yeah, she had time.
Yeah. Did you want to make sure that he kind of, sought his way through medical school? He was committed.
Exactly.
My version of that story when he asked me out, the way I remember it is I remember this medical student showing up one day and then just sort of like following me around the hospital. Like I'd sort of be places and then like there he was. And then like I'd go someplace else and he was there too. And I was like, I don't understand what's happening here. And then one day I was in a patient room, like sort of talking to a patient, and I saw him sort of like hovering outside the door. And then he had been waiting for me to wrap up my day so he could ask me for coffee. And I was like, oh, but he's a student. I like didn't have time. I was like, I'm important. I'm an intern here. I've got work to do. And then I got over myself and I realized how great he is.
Aw. Well, I just like the conflicting stories. Like there's one story and then you have another one. And I don't even know if there was actually any overlap there, to be truthfully honest.
It's two slightly different versions of reality.
Yeah, it's fine. It's great though. It's all for good listening though. So what are some things that you guys enjoy doing together?
We'll talk about work.
Yeah, there you go.
Talk about work. Yes, you did say that. Work.
A lot of that.
Talk about your kids. You have 2 daughters. How old are they?
We do. They're 9.5 and 5. And they're kind of replicas of Maddie. They're like mini hers. So they're both mama's girls.
We spend a lot of time over the last year coming up with ways of entertaining them. So that's how we spend time together. We spend time together going like, what are we going to play with them next? And how are we going to entertain them
Especially
next?
since they're both at home.
Yeah.
Because of the virus. So they're both learning from home. So we have to keep them more entertained since they don't have the same social interactions with their friends. So it's definitely keeping us on our toes.
Again, I know you said they're 9 and 5 and they're young and there's still plenty of time for them to figure out what they want to do with their lives. But do either one of them mention about becoming doctors like mommy and daddy, or is any of those conversations kind of follow even in the same specialty? Does any of that come up?
I don't know if Princess Ballerina counts as a doctor, but that's...
We're very serious about Princess Ballerina right now.
Yeah.
We have ballerinas and we have princesses, but I don't think we have princess ballerinas. So I would be a fan
They're
of both.
They're trailblazers, our kids. They're going to find a way.
You should be proud, right?
Right. I majored in Princess Ballerina.
It's like, what college offers that? That's awesome. And I just am curious, just any advice? I mean, like you said, the one, elderly physician mentioned about working together. And it's funny because the prior organization that I come from, it actually married couples is the norm. So I came from a nonprofit. So this is normal to me. But I'm curious, what's your advice for couples that work together at the same organization? Just what would you tell them?
I think it's different for each type of field. In medicine, it might be easier because you can always bounce ideas off each other. But if it's more of a competing type of industry, it might cause some disturbance in the relationship. But I think you just have to make the best of it, as long as you can share ideas.
I think it helps if you're
and
friends with
share lunches.
Yeah, sharing lunches is good. We highly recommend trying to find time to eat lunch together, even if it's only for like 5 minutes. That's kind of nice. And also, I mean, we were friends before we, became romantically involved. So I think that except for that one coffee date, and then years went
except
by.
for that time you said about the annoying, medical student that was bothering.
Yeah, when we reconnected, we were friends for, first, and I think that really helps. It's, because we're friends and we're not competitors. We're like a team, which I think helps a lot.
Mm-hmm.
Awesome. All right, this is the question portion of events, and I'd love to move on to the game. Is there anything else that you guys want to add?
No.
I can't think of anything.
All right, so I sent you guys a series of questions. So again, it's the Newlywed Game, the breakdown edition. There's no grand prize or anything, so I apologize in advance. But again, I asked you both the same series of questions. So really what we're just trying to do is see how well you both know each other.
We're old newlyweds now, though. It's been 15 years for us almost.
Yeah. All right, well, this is going
to be embarrassing. We're probably going
to. I know. I was going to say, is there any last words before we get started?
I'm going to say my last words are that Noop is very hard to shop for in terms of like gifts and things like that. So, I feel like he changes his mind. So it might not always be the same favorite X, Y, or Z. So I'm going to say, in my defense, I might not get these correct.
Mm-hmm.
Okay. That's fair.
Same answer for me too.
Awesome. All right. Let's get started. I'll just ask the question, and if you both want to answer one at a time, what you think the other person said. I think that's making sense. But all right, what is your spouse's favorite color?
All right, so I think that you said for me. I don't know what I think you said for me. You go.
I'm guessing she said blue for me.
She did.
There you go.
Carolina blue.
Yeah,
she did.
Yeah.
I was gonna let it slide, but that was. But go ahead.
I don't know. I'm gonna say blue also.
Ooh.
What?
It was red.
Really?
I don't know.
No. Okay.
All right. Wait, I'm not keeping score here. Hold on a sec. All right, now I am. Okay. All right. What is your spouse's favorite restaurant?
I'm going to say, you probably said for Distrito.
Oh, I forgot about that. They closed down.
Yeah, but they still have one in Philadelphia.
All right, that's not correct.
I'll say, maybe she said Farm and Fisherman for me.
No, but I forgot about that one. No, pick the other one.
Bonsai?
No, the other one. They're closed on Sundays.
Chick-fil-A?
You love Chick-fil-A.
Not a restaurant.
I feel like that counts.
All right.
It counts here. So third time's the charm on that.
What'd you say for me?
I picked the Thai place.
Oh, I do like that place.
Yeah.
Farm and Fisherman is one of my faves. So
yeah.
All right. What did the other say about your spouse's best personality trait?
My optimism.
Okay, that's fair too.
Yeah.
That's fair, but not correct.
My calm under pressure.
Yes.
Nice.
Good.
We're verbatim.
I mean, almost exactly. I said I said something like the ability to stay calm in a crisis.
Nice.
Yeah, I do appreciate that.
What did he say about you?
What's the question? Your best quality?
What did he say that your best quality was?
Like organized with the kids?
No.
No. I'm so good at this.
It's not personality.
Oh. I have no idea.
He said.
Yeah, I give up. I don't know.
Okay. Encouraging, imaginative, and sociable.
Oh, that's so nice.
It's wrong.
We're doing so badly.
I know, but you're like doing so bad, but in the best way possible. This is my favorite question, just because some of these answers. But what is your spouse's favorite junk food?
She probably said potato chips.
Okay.
Sour cream and onion.
Yes. Are you giving hints over there?
No, for really. You got that one for
Yes.
Cheating didn't even occur to me. Darn it.
I didn't know it was an option here.
Unless we could do that.
What did he say that yours were?
Let me see. Like crackers?
Crackers.
Oh, no. I don't know. Like cheese and crackers?
It's not junk food.
I don't know. I don't really eat junk food.
You want one more guess?
Chex Mix? Okay, I give up.
He said scones, muffins, and cookies.
Oh, yeah.
And I saw that answer and I was like, scones aren't a junk food, so.
See, yeah, I think of that as, No, that is, again, I guess it kind of is a junk food.
Yeah,
I just don't think of it as a junk food.
When you
It's
eat
my
4 or
attitude.
5 of them at a
It's my
time, it's a junk
attitude.
food.
Yeah, it's
Yes.
my attitude.
When you're
towards
popping
sugar.
them back like potato chips.
Exactly.
That's the problem.
Yes. Okay. Oh, this is a good one. Who is tidier? Who did each other say was tidier?
I forget what I said for this one because I don't feel like you're untidy. I mean, I think that you said you.
I think you said me.
No, I think I can't remember what I said, but I thought that you would have picked me as the tidier.
I think I did.
Yes.
Yeah. Did we both pick each other?
Who did you pick, Dr. Dholakia?
Oh wait, I think that Noop said it was me that was the tidier one.
Yeah, he did say that.
Yeah.
All right, so I think she picked me.
That's incorrect. She picked.
Oh, I picked me. Oh, sorry.
But not bad. Okay.
You did the cleaning.
Right,
I feel
that's
like.
true.
Yeah.
What is your spouse's favorite TV show? What did the other one say your favorite TV show is?
For me,
Mm-hmm.
I think that you said House Hunters or something of that nature for me, because I could watch HGTV like nobody's business.
I probably think that she put down the same answer that I put for her, which was The Daily Show.
Oh, I forgot about the show. Darn it.
No.
So, Dr. Dholakia, you said, and I quote, he could binge watch the Food Network like nobody's business.
That's true.
And then you did say, for her, The Daily Show.
Actually, I forgot about it. I forgot about The Daily Show.
That's okay. That's okay. Okay, here's another good one. Who does the most cooking? Who did the other one say?
Me.
Him.
Okay. Yeah, great. Easy.
That was an easy one. There's really no contest.
Yeah. Okay. And who is the better cook?
Him.
Me.
Well, there you go. Who's more adventurous?
I think she picked herself.
And I think you picked me.
Yes. Yes.
We both said it was me.
Yeah, there you go.
There you go. Oh, okay. What is your spouse's favorite meal? What did they say?
I think she said pizza for me.
And I think he said, is it bad that I don't even know what my favorute
Scones,
is?
cookies.
It's scones. It's a whole plate of baked
Cheese and
goods.
crackers.
That's what it is. I think he said like Thai food for me.
He did. He said drunken noodles.
Nice.
He said that, and he said, well, he said anything he cooks, or eggplant parm, or drunken noodles.
Those are all accurate.
Mm-hmm.
Yes. Okay, great. 1 out of 3 of those isn't bad. We would take any answer in there. All right, last question.
Wait, what, did she pick pizza for me?
No, I picked fish tacos.
No, you
Fish tacos. Those are good.
All right, last question. What is their favorite band / artist?
I think you said for me, John Butler Trio.
Oh, I forgot about it.
So obviously that's no.
So, didn't get that one.
For me, she said maybe jazz or some type of smooth jazz.
Did I say elevator music?
You did. You did. And
I did say that.
And you said 80s metal, so I like
Yes.
It was one of the two. Yeah, it was one of the two.
the
He has
major contradiction.
diverse tastes in music. Yeah, it spans the range.
I
Yeah,
picked
that's really like
Yeah,
0 to 60.
both extremes. Yeah.
I think I wrote down Derek Trucks Band for her,
Oh, that would have been.
but that was like 15 years ago.
Yeah. Well, see, because that's from like when we first met. So then it sort of evolved from there.
I still listen to stuff from 15, 16, 25 years ago, so, you know.
Well, 80s metal is
But now I listen to like
40 years ago.
Disney musical tracks. 'Cause,
Oh.
like all I listen to.
What's their favorite Disney character?
Moana.
They're really into a Moana. We listen to the Moana soundtrack a lot.
Okay. Are you guys over that soundtrack?
I'm not over it. I think Noop is tired of hearing me sing it. I'd say that's fair.
That's amazing. Well, I hate to kind of break this conversation up, but is there anything else you want to add, or any PSA to potential patients? Or again, I know we talked about, working together and all that, but yeah, just any last words from each of you would be great.
No, I think if patients want to pay twice as much to see us both at the same time, it might be entertaining.
Honestly, I would see both of you at the same
right? That'd be great. And we just bicker in front of our patients.
We're like a comedy act. Yeah. we'll take care of your back pain and entertain you.
And make you laugh. Like, what more can you ask for?
Exactly.
Well, again, I want to thank you both for joining me today.
Thanks for having us.
Thank you for having us.
I really did have fun, and hopefully we can do this again in the future.
That would be great.
Awesome.
All right. Thank you.
Thanks, Alex.
So last up, I'd like to welcome in spine surgeon at Rothman Orthopaedics, Dr. Barrett Woods. He has been a surgeon at Rothman for, how many years have you been here, Dr. Woods?
It's been 5 years now.
Okay, great. And talk about a few of your areas of interest in spine surgery.
So I'm an adult trained spinal surgeon. I did my fellowship at Thomas Jefferson University, Rothman Institute, and been in practice for 5 years now. My predominant specialty is in conditions that affect adult spines, most commonly degenerative conditions such as disc herniations and arthritis, which compress nerves and spinal cord and can affect the patient's function. So that's my predominant area of interest. I also take a lot of call and deal with spinal trauma. So anything from broken necks to acute disc herniations, infections, gunshot wounds, things of that nature. And then there's a component of my practice as well in which I treat patients with deformities, scoliotic curves, and unusual alignments of the spine. Those all fall within my area of expertise.
Awesome. So this leads me into our medical incredible. You actually treated a 67-year-old male patient that fell off of his deck, broke his neck, and was paralyzed. Wow. When something like that comes across your desk, or you see this or you hear about this, what comes to your mind when you hear about something like this?
Well, I think, it's important to get all the information. Obviously, these are incredibly traumatic injuries. The families are obviously very emotional. And so it's my job to try to, maintain a level head, to try to get all the appropriate information so that I can make the best possible decisions. When you're dealing with someone with a spinal cord injury, timing is really of the essence. And so it's important that I can accumulate as much information as possible so that I can put the patient in the best possible position for recovery.
And again, so is it really, I don't want to say it's a one size fits all, but again, when you hear about something like this, what is the first thing that you have to do? Or, does someone call you? Is this something that goes through the ER? How do you get wind of a situation like this?
I'm on call at the hospital. So the patient will come in through the emergency room, particularly for something like this, where it was a trauma, where he had to be life flighted to the hospital. And typically the emergency room physician or the trauma surgeon who's on call will call me and tell me what the situation is, and they'll get imaging studies, and I'll rush to the hospital to evaluate the patient. So typically the first person that's calling me is typically either the emergency room physician or the general trauma surgeon on call who is in the emergency room when the patient comes in.
So now, again, you get that phone call, you arrive at the hospital. What's the first thing that you do? Walk us through the action or your treatment plan for something like this.
Well, the first thing I do is see the patient, kind of see what the situation is. Is he stable? When I say stable, I mean from a hemodynamic standpoint. Is he maintaining his blood pressure? Is he ventilated? Can I speak to him? If he's not on the ventilator and I can speak to the patient, then I would examine him to try to determine what his baseline level of function is. And then once I kind of have an idea of the severity of the situation, any of the other surrounding injuries or issues which may be affecting him, it's important to try to get some history in regards to medical history. Is this person someone that walks independently at baseline, or were they in a wheelchair for years? Are they a diabetic? Do they smoke? Are they on blood thinners, which would affect my ability to do surgery safely on them? And once you compile all that information, typically we'll look at imaging studies. And then once I see the imaging studies and correlate that with their physical exam and history, then at that point I can formulate a surgical plan to take the person to surgery, mobilize the surgical team, call the operating room, and then go discuss the issues with the family. And, that's, it's a very emotional time. Someone comes in and their loved one is paralyzed. And so, it requires a face-to-face conversation. And, one thing about spine surgery is it's incredibly humbling. If you ever meet an arrogant spine surgeon, they're a fool, because what is clear is that we have some limitations in the things that we can fix. And so that's why I say my prayers every day, and I try to put people in the best position. But the fact of the matter is there's a confluence of factors that really influence how well people do. In spinal cord injury, the things that we can affect, we try to do that by stabilizing the spinal column, getting patients to surgery quickly. But with spinal cord injury, there's a stroke of luck, and, if you're religious, you could say it's God or something, but, we can't completely fix that. So we try to provide the family with as much information as possible, assure them that we will do the best possible job for their loved one, and then we go execute the plan and try to get the patient in the best possible position.
I love that you just mentioned there's like a certain kind of temperament for a spine surgeon, especially being in this situation. So I would say, what's your number one, I guess, the trait, obviously being humble, but would you say having a calm demeanor, is that something in this situation that is the most helpful?
Well, I think it's important to be able to compartmentalize. You're seeing people who are in very traumatic situations. And so, I have to be able to, in a calm and cool manner, collect all of the information so that I can make the best possible decision. But at the same time, this is not robotic. We are human beings. I have to be able to then also be able to communicate with the family and sympathize with their concerns, but also, be focused on the task at hand. So I think compartmentalization is a very important thing that you have to be able to do. You have to be cool and level-headed in the situation, and try to get all the information as possible so that you can make the best decision for the person. At the same time, it can't be so robotic that you have the inability to communicate and connect with people, because you can imagine, a loved one is paralyzed. You can imagine the hysteria and the concern surrounding that. And so, I do the best I can to be as honest as possible. I'm always honest, but also to deliver, the information in a manner in which they can receive it, considering the circumstance.
And I think exactly what you're just saying. I think those are traits and qualities that not only just spine surgeons, I think all physicians, it doesn't matter what specialty that you practice, I think, and just as people, we all need to have, and just kind of being able to relate to people, talk to people, and just kind of understand and put yourself in their shoes, because, never know when it could be you in that situation, or, and you'd have to deal with it. So I think that's good advice for anyone. One point I want to go back to, because you mentioned the first thing you'd kind of do is like you'll go in and you'll check to see if the patient is stable. And that's before we even start going into the orthopedic side. Do you consult with any other physicians? Is it checking, is there a cardiologist there? Is, the ER doc? Like, is there a team outside of an orthopedic spine surgeon that you are dealing with when this case, again, comes in your lap?
Yes, definitely. So if it's a traumatic case, say a motor vehicle accident or a fall or anything that involves an acute traumatic incident, then typically the trauma surgeon who's at the hospital on call is kind of the overseer. And so there is a sequence of events which occurs with every patient that comes into the hospital in a traumatic situation, from someone that has a broken toenail to someone who has a terrible cervical fracture dislocation. The same steps are always met, and that's that their airway is assessed, they're assessed from a hemodynamic standpoint to make sure their blood pressure is stable. All that is overseen typically by the trauma surgeon, and then the trauma surgeon will consult the appropriate subspecialist for whatever area of expertise there is. So the first thing you do is make sure the patient's going to live and that they're stable. And then the second thing is, once you realize, oh, this person has a spinal cord injury, that's when they would call me in, and there would be a discussion as to, whether it was safe to take the patient emergently to surgery or not.
Thank you for that. Just kind of moving forward. So God forbid if this was to happen to me, what would be my immediate steps, or what should I do? I hope nobody has to deal with this, but what would your advice to be, if there is some sort of spinal cord injury, what would you tell the patient? You never know, they could be in a position that they would have to help someone. So what would you suggest that's the first thing that they do?
Well, I mean, I think it depends at what stage of the game we're talking about. During the initial injury, injuries can be potentiated if someone has an unstable spinal column and if they're moved inappropriately or not properly. So if you suspect someone with a spinal cord injury, you have to, you really don't want to move that person. They need to be log rolled and secured appropriately so you don't potentiate any injury. And then, I think the thing with spinal cord injury and the reason it's so humbling and so painful, it's devastating, not just physically, but also emotionally, and the impact that these type of injuries have on people is far more than physical. All patients that have spinal cord injuries have some level of depression afterwards, understandably so. And the impact that it has on patients' families is profound, because particularly no matter who it is, but if it's a younger person and they have their life ahead of them and now, their whole life trajectory has changed in a moment. So, I mean, I think the most important thing with these spinal cord injuries is to understand, this is not just a physical battle, it's a mental battle. It's going to require time, patience, tough love sometimes. But the fact of the matter is this is far more than a physical thing. It's an emotional thing. And watching people ride that roller coaster where the initial shock and fear of the spinal cord injury, then the unknown as to what degree of function that they will regain. And, I've seen the full gamut of people who were completely paralyzed and did not regain anything to people who came in paralyzed and walked out of the hospital. And seeing, riding that roller coaster, that emotional roller coaster, and then dealing with whatever residual deficits that you have. I mean, some people really make the most of the situation and really, have powerful stories. And I think in order to do that, you really just got to take it one day at a time, and you got to acknowledge kind of the emotional impact of it as well as the physical impact.
So I want to bring this full circle because obviously we call this the medical incredible. So this isn't all gloom and doom, but why was this case a success? Talk about that, or what was your biggest surprise? And I think people would appreciate, hearing what the success was. So if you want to talk a little bit about that, what happened 6 weeks later when you saw this patient?
Well, so this was a very active and healthy guy. He slipped on his deck. He had what's called a cervical fracture dislocation. So his bones translated in his neck. And as a result of that translation, his spinal cord was compressed. So when he came to the hospital, he had some tingling in his feet, but no motor function in his legs. He couldn't move his legs at all. He had very little sensation in his legs. He had weakness in his arms as well. And I took him to surgery emergently that night, realigned his spinal column, and then took him again the next day after we got a repeat MRI just to further provide stabilization to his spine. And, he had a very loving and supporting family, and obviously they were very concerned. And I told them, that the statistics that, these type of injuries, there's about a 5% chance that, he'll regain enough function to walk. And, miraculously, he did. I mean, in 6 weeks, he walked into the office. And that's why I say, this is a humbling thing, in that, his family was obviously very appreciative to me, but I had to tell them that this was God. I realigned his spinal column, but I didn't fix his spinal cord. We got to it in a timely manner, and I did everything I possibly could for him. But for me to sit and take credit for him walking again is just not accurate. And that's why these things are very humbling, because there's plenty of patients that you do the same thing. You realign their spinal column and they don't walk, so, and that's why, this profession is very fulfilling and gratifying for me, but it's also humbling. You realizing that you do the absolute best you can for people, and you hope and pray that they do well. Spinal cord injury is one of the few things where it's just not that predictable. People come in for regular routine spine surgery. I can tell you definitively you are going to do well. Spinal cord injury is a different entity, and so he ended up walking. He regained, about 90% of his function, and so it was a miracle because he certainly could have been in a wheelchair with the severity of his injury.
So I'm sorry, I want to repeat that number you said. You said there's a 5% chance that he couldn't walk or that he would. Just clarify that again. I just want you to say that.
So he had an incomplete spinal cord injury, and he had a bilateral jump facet fracture dislocation. So historically, if that's about a less than 5% chance that you will walk again.
Okay. That's amazing. And I mean, literally, like I said, you look at the odds right there, 5% to 95, we can all do the math, but, and I appreciate your humbleness in this all, but honestly, how did you feel?
Well, it's incredibly gratifying. It's
Yeah.
incredibly gratifying to, see him come in. I did that initial operation maybe 1:00 at night. It was in the middle of the night. I got out of bed to do it because when, you have a spinal cord injury, timing is of the essence. As long as that spinal cord is compressed, the more likely it is that that patient will have permanent deficits. And so getting that pressure off the spinal cord is one thing that we can do that can influence their outcome. So this is not something that you sleep on. So, we got out of bed, our team got out of bed in the middle of the night, went and did the operation. And so to see him have that type of recovery was obviously miraculous. And it makes you feel very good about, all the hard work and the time and the effort when you can positively influence, someone else's life. That's what it's all about. That's why we do this.
It's truly amazing. Is there anything, again, with this particular case that you want to add or, anything for potential patients that you'd want them to know?
Well, I mean, I think with him, he had an incredibly positive outlook. Obviously, like I said, you have these injuries. There is, an incredible emotional toll. And I've had patients who had injuries like him who did not regain as much function, who did just as well, mentally and spiritually and physically. They turned it into an incredible positive. They were happy to be alive. And so it's not just, him. It's when you get someone through this type of traumatic event and then they find a way to move forward with their lives and to, find a way to help and influence and impact other people, that's just as gratifying, and I think that it's one of those things that, Lord forbid, we can't control all the things around us. If something like that happens, you got to take it one day at a time. It certainly should make all of us count our blessings. I tell you one thing about myself is that it's hard for me to complain, even on my worst day, because I see people in much more dire situations than myself, and it makes me count my blessings on a daily basis.
You were speaking some truths to us today, so thank you for that. But before I let you go, I did mention earlier, and I know we were kind of doing, the whole episode, we were speaking to, Dr. Sinha and Dr. Dholakia earlier, and they're married, but you are also actually married to another Rothman physician, Dr. Shaylin Woods. What's that like, actually being able to work in the same atmosphere with your wife? And do you guys ever collaborate on patients or research? Kind of talk about that a little bit before I let you go.
Well, it's really cool because on a number of fronts. First of all, she works part-time, but she has the full-time job of raising our 3 sons. And I can tell you that's as challenging of a job as anything that I do. And so she balances, actively practicing while still, keeping our sons in line, which is, a feat all in and of itself, because when I'm watching the kids, it's a different situation at the house. They're eating applesauce and doing whatever they want to do.
Yeah.
But it's really cool because I think one thing that I really enjoy about working with her is just to see how well respected she is. I know my wife, I love her, I married her for a reason. And to see how people interact with her and to see, how she is received is something that makes me smile. And I think vice versa. And very commonly, we have patients back and forth. She's a physiatrist. She treats non-operative spine. So people who fail her care often I end up taking care of. And so, there'll be plenty of times where she sees someone she's concerned about and she's like, Barrett, this person I saw, and what do you think about this and that? And so, it just adds another layer to our relationship. And it is really cool for me to see, how good she is at her job, and the same things that made me fall in love with her, patients love her for. So it is cool to see that.
So I guess it's safe to say that spines rule in your household. You guys know spines, right?
Yeah, I think we got that area covered. We have that area covered pretty well.
Sounds good. So yeah, I mean, just for any potential listeners, any issues with your spines, we have, like you said, a physiatrist, and then we have a spine surgeon. So you guys have got it covered down there.
Yes, we do.
Awesome. Well, I'd like to thank you again for joining me, explaining that incredible story. Patient was absolutely lucky to have you. We're lucky to have you here and your wife. And thanks again.
My pleasure. Thank you for having me.
We'd like to thank Dr. Dholakia, Dr. Sinha, and Dr. Woods for joining me today. If you missed the first episode, we now have a landing page. It's on rothmanortho.com/breakdown. That's rothmanortho.com/breakdown. That hosts all of our episodes, plus we are now available on Spotify, Apple, and the Rothman Orthopaedics YouTube channel, plus a few other listening platforms. So make sure you download and subscribe to whatever platform you utilize. Thanks again for listening, and until next time, take care.